In the realm of antifungal medications, fluconazole emerges as a beacon for those battling fungal infections. This comprehensive discourse aims to elucidate the multifaceted uses, benefits, and cautions of fluconazole, guiding individuals through its therapeutic landscape. As we navigate these waters, our objective remains to furnish readers with the insights necessary for informed healthcare decisions. Introduction to fluconazole. In our journey to understand fluconazole's role in contemporary medicine, it's imperative to start at the foundation. Fluconazole is a potent antifungal medication, belonging to the triazole class of drugs. Its primary mechanism involves the inhibition of fungal cytochrome P450 enzyme, essential for the synthesis of ergosterol, a critical component of the fungal cell membrane. By disrupting this process, fluconazole effectively hampers fungal growth, offering relief and recovery to the afflicted. The inception of fluconazole marked a significant advancement in antifungal therapy. Its broad spectrum of activity against a plethora of fungal organisms, coupled with its favorable pharmacokinetic profile, has cemented its position as a drug of choice for many clinicians. Unlike its predecessors, fluconazole's ability to penetrate bodily fluids, including cerebrospinal fluid, allows it to combat systemic and invasive fungal infections efficaciously. Moreover, fluconazole's oral and intravenous formulations enhance its versatility, making it accessible for both outpatient and inpatient treatment scenarios. This dual-route availability ensures that individuals across various clinical settings can benefit from its therapeutic prowess. As we delve deeper into fluconazole's applications and implications, it's crucial to appreciate this foundational knowledge that underpins its widespread use. Common applications of fluconazole. Fluconazole's arsenal against fungal infections is vast and varied. Its primary application lies in the treatment of candidiasis, a fungal infection caused by Candida species. This encompasses oropharyngeal and esophageal candidiasis, often seen in immunocompromised individuals, including those undergoing cancer treatment or living with HIV/AIDS. Fluconazole's efficacy in these cases is not merely about alleviating symptoms but also about restoring quality of life for those affected. Beyond candidiasis, fluconazole plays a critical role in combating other fungal infections. Cryptococcal meningitis, a life-threatening condition predominantly affecting those with weakened immune systems, stands as a testament to fluconazole's life-saving potential. Its ability to penetrate the blood-brain barrier allows it to effectively reach and eradicate the fungal infection from the central nervous system. Furthermore, fluconazole is employed in the prophylaxis of fungal infections in high-risk groups. Patients undergoing bone marrow transplants or those with severe neutropenia are examples where fluconazole's preventative capacity is harnessed. By mitigating the risk of fungal infections, fluconazole not only safeguards the health of vulnerable individuals but also supports the success of critical medical treatments. Benefits of using fluconazole. The advantages of fluconazole extend beyond its antifungal spectrum. One of the paramount benefits lies in its pharmacokinetics. Fluconazole's capacity for oral administration ensures ease of use, facilitating adherence to treatment regimens. This attribute is particularly beneficial for long-term therapy, where patient compliance is crucial for success. Additionally, fluconazole's favorable safety profile distinguishes it from other antifungal agents. Adverse reactions are relatively rare and generally mild, making it a suitable option for a wide demographic, including those who may not tolerate other antifungals well. This aspect of fluconazole significantly enhances patient quality of life, as individuals can undergo treatment with minimal disruption to their daily activities. Moreover, fluconazole's robustness against various fungal pathogens provides a broad therapeutic window. Its efficacy across a range of fungal infections means that clinicians can employ it in diverse clinical scenarios, ensuring that patients receive prompt and effective treatment. This versatility is particularly advantageous in settings where the fungal species may not be immediately identifiable, offering a reliable initial treatment option. Potential side effects of fluconazole. While fluconazole's benefits are numerous, it's imperative to acknowledge its potential adverse effects. Commonly reported side effects include gastrointestinal disturbances, such as nausea and abdominal pain, which, while generally mild, can affect patient compliance. Headaches and dizziness have also been observed, although these symptoms typically resolve with continued treatment. In rare instances, fluconazole can induce more severe reactions. Hepatotoxicity, manifested as elevated liver enzymes and, in extreme cases, liver failure, underscores the importance of monitoring liver function during treatment. Allergic reactions, although uncommon, necessitate immediate medical attention, as they can escalate to more serious conditions, including anaphylaxis. Furthermore, fluconazole's interaction with other medications can potentiate side effects. Its inhibition of cytochrome P450 enzymes can lead to increased plasma levels of co-administered drugs, heightening the risk of adverse reactions. This highlights the need for a thorough review of a patient's medication regimen before initiating fluconazole therapy. Dosage recommendations for fluconazole. Navigating fluconazole's dosage landscape requires a tailored approach, taking into account the infection's severity, the patient's underlying health conditions, and potential drug interactions. For oropharyngeal and esophageal candidiasis, a typical starting dose may range from 100 to 200 mg daily, with adjustments based on clinical response. Invasive infections, such as cryptococcal meningitis, demand higher dosages, often initiated at 400 mg on the first day, followed by 200 mg daily. Renal function plays a critical role in fluconazole dosing. Given its renal excretion, patients with impaired kidney function may require dosage adjustments to mitigate the risk of accumulation and toxicity. This underscores the importance of renal function assessment before and during treatment, ensuring that the dosage is both effective and safe. Pediatric and elderly populations warrant special consideration in dosing strategies. Children's doses are typically calculated based on body weight, while in older adults, the presence of comorbidities and concomitant medications necessitates a cautious approach. This individualized dosing framework underscores the need for close collaboration between healthcare providers and patients, ensuring optimal outcomes. Risks associated with fluconazole. While fluconazole is widely regarded as safe and effective, certain risks warrant consideration. Its potential for inducing congenital anomalies when used during pregnancy, particularly at high doses, necessitates a careful evaluation of risks versus benefits in this population. The U.S. Food and Drug Administration categorizes fluconazole as a Category D medication for pregnant women, indicating evidence of fetal risk, thus advocating for its use only when the benefits justify the potential risks to the fetus. Patients with pre-existing liver conditions face increased risk when using fluconazole. Given its hepatotoxic potential, individuals with hepatic impairment may experience exacerbation of their condition, highlighting the need for vigilant liver function monitoring and, in some cases, the exploration of alternative treatments. The risk of developing resistance to fluconazole also cannot be overlooked. Prolonged use, particularly in immunocompromised individuals, may lead to the emergence of resistant fungal strains, compromising the efficacy of treatment. This phenomenon underscores the importance of judicious use, adhering to prescribed durations and dosages to minimize the risk of resistance development. Precautions when using fluconazole. To mitigate the risks associated with fluconazole, several precautions should be observed. Prior to initiating therapy, a comprehensive medical history, including a list of current medications, should be reviewed to identify potential contraindications and interactions. Regular monitoring of liver function and renal function is paramount, ensuring that any adverse effects are promptly identified and addressed. For individuals at risk of QT prolongation, a condition where the heart's electrical recovery time after beats is lengthened, caution is advised. Fluconazole has been associated with QT prolongation in rare instances, necessitating monitoring in susceptible individuals. In the realm of pregnancy and breastfeeding, the decision to use fluconazole should be made with careful consideration of the risks and benefits. Alternative treatments that pose lower risks to the fetus or infant should be considered, with fluconazole reserved for situations where the potential benefit outweighs the risk. Alternative treatments to fluconazole. For those unable to use fluconazole or seeking alternative options, several treatments are available. Itraconazole, another triazole antifungal, offers a similar spectrum of activity with different pharmacokinetic properties. Amphotericin B, while potent, is generally reserved for severe, life-threatening infections due to its toxicity profile. Echinocandins, such as caspofungin, offer another class of antifungals with a different mechanism of action, ideal for treating certain invasive fungal infections. Additionally, topical antifungals may be appropriate for localized infections, minimizing systemic exposure and associated risks. Fluconazole and drug interactions. Fluconazole's interaction with other medications is a critical consideration. Its inhibitory effect on cytochrome P450 enzymes can lead to increased levels of co-administered drugs, such as warfarin, leading to an elevated risk of bleeding. Similarly, interaction with statins can increase the risk of myopathy and rhabdomyolysis. Adjusting dosages of affected medications or selecting alternative treatments can mitigate these interactions. Close monitoring and communication between healthcare providers and patients are essential to navigate these complex interactions safely. Conclusion: Fluconazole represents a cornerstone in the management of fungal infections, offering a blend of efficacy, safety, and versatility. However, its use is not without risks and requires careful consideration of potential side effects, drug interactions, and individual patient factors. By adhering to recommended precautions and dosage guidelines, the therapeutic benefits of fluconazole can be maximized, enhancing patient outcomes in the fight against fungal infections. As with all medications, a collaborative approach between healthcare providers and patients is key to ensuring safe and effective treatment, paving the way for optimal health and well-being.